Thank you for staying with us. The Nigerian Association of Resident Doctors has commenced a 7-day warning strike to push for the rescue of a Kaduna-based doctor, Dr. Ganiyat Popoola, who was kidnapped last December and has spent about 8 months with her abductors. The strike, which began on Monday, is holding across the country, and patients have been left stranded as the doctors shun work to press home their demand. The action comes as they had explored several measures, including sending several official letters of request for intervention to authorities embarking on peaceful protest on a 2-week deadline for the release of their abducted colleague, which elapsed without her rescue. The strike is causing patients distress, leaving them at the mercy of the few available doctors, and caused significant delays in accessing healthcare services as the strike progresses. Joining us via Zoom from Abuja for this conversation is the President, National Hospital Abuja, is also the North Central Caucus leader, Nigerian Association of Resident Doctors, Dr. Babajide Lanre-Arimo. Good morning, and thank you for joining us on TVC Breakfast.
Good morning, Nigerians. Thank you for having me.
All right. It's so sad that it's been 8 months since her abduction. Can you talk to us about the level of engagement of the association with the family and also security agencies?
We've established contact with our husband. You'll recall that our husband was also kidnapped, but was later released, and we've been discussing with him. We've also discussed with some security agencies, and we've engaged our principal ministry, which is the Ministry of Health. On Monday, there was a meeting between the president of our association and the Minister of State for Health, and we expect to get the needed results. To get the result very soon.
Right, but then some of the questions a lot of people are asking, especially people, those who are seeing to our health, the healthcare practitioners, so to speak, they've been asking questions, because due to the recent surge in high-profile, abductions, including the healthcare professionals, what do you think is that attraction, from the kidnappers, apart from the fact that they're also kidnapping Nigerians who are not medical practitioners and all of that? What do you think is the, surge in the attractions in kidnapping those who are helping us to get better?
I think it's actually a general thing. You will agree with me that the rate of kidnapping around the country has been a very rapid increase in that. But we feel that healthcare workers are targeted, probably because they feel we are, for economic reasons, maybe we're able to give them the ransom that they demand. But I think that's a misconception. The average Nigerian doctor, or even the average Nigerian health worker, as it is today, is barely struggling to survive. The economic hardship has not left out the health sector. So it's a misconception from the bandits or the kidnappers, as we put it now. And we are calling on governments to actually put the extra effort in protecting the lives of the health workers around the country.
The previous misconception about this issue was that there has been no response by security agencies or no reaction by the federal government. But if I got you correctly, you said you met with the president on this. What was the outcome of that meeting? And why go ahead or continue the strike if, there have been discussions?
It's an ongoing discussion, and I may not be able to reveal all the details at the moment, but I can assure you that there's already movement in the government quarters. And if there's a need to shelve this strike, then we'll go ahead, or we'll just make it complete by calling it off on Monday morning.
Well, if you look at the strike action by NAD, that's actually brought attention to the vulnerability of the healthcare workers, and Nigerians at large. So with the discussion you're having with the government, what are the things that you actually put on the table in ensuring the safety of healthcare professionals?
We may not like to, like I said, we may not like to disclose a lot of the details, but I feel if Nigerians are safe generally, then the healthcare workers are safe. If there's no rampant kidnapping, then nobody will go in to pick up a medical doctor who is just trying to attend to his patients. And there's a growing trend whereby doctors are picked right where they work. Dr. Popoola was kidnapped in the staff quarters of the National Eye Care Center in Kaduna. Inside the house there in the staff quarters, Professor Ekanem in Calabar was picked up in a clinic where she was attending to patients. Recently, a consultant in the Federal Teaching Hospital of Oja was kidnapped. on our way to work. So this is a rising trend that we feel government should curb. If Nigeria is safe generally, then that will just extend to the healthcare workers. But if Nigeria is not safe, then the healthcare workers who maybe are seen to be above board will be targeted.
Well, from an intelligence angle, some will say that perhaps security agencies might be making moves, but may not want to disclose, like you have also rightly said. But did you for once think that probably this will, lead to a pressure on security agencies and they may take a wrong step?
Yeah, they are trained in their jobs just the way we are trained to attend to patients, and I believe they should be able to cope with the pressure that comes with their job. Being an expert in the field means you should be able to cope with the pressure that comes with it. If we had seen palpable movement, if we had seen that sincerity of purpose, trust me, Dr. Popoola would not be in captivity for 8 months. Yesterday made it 8 months that she's been in captivity. She was kidnapped December 27th, 2023, and it's August, and she's still not rescued. So we are aware of the efforts that they've put in, and they are still putting in. But we need results. We need results. At the time she was kidnapped, we keep saying she was a nursing mother. And have we taken time to think of the baby she left behind, of her family, of her husband, the post-traumatic stress disorder, and everything that her family members are going through? Even if she's released as it is today, it's going to take her years to recover from the trauma that she's been through. So these are things that we don't want to discuss openly, but we should think of it. And for those who think we've taken a very drastic measure, I think that's the last resort. That's the only way we could really get the government's attention, because it's been wait, and then we've waited for over 8 months, and we felt that was the right time to act. And before we took that decision, we've sent out warnings, we've sent out communiques, we've sent out notices to those in government. So it's just a last resort and a last option. And we want our patients, Nigerians across board, to please bear with us.